Hello, my name is Sean McCafferty. I am an ophthalmologist at Arizona Eye Consultants. I have relevant conflicts of interest listed, namely CATSPOAGProg2, which owns the IP on the product being tested. I will be discussing intraocular pressure measured by corneal biomechanical correcting and standard Goldmann prisms in stable and progressive primary open-angle glaucoma. The purpose of this study is to evaluate the differences between intraocular pressure measured by a Goldmann applanation tonometry prism and a modified correcting applanation tonometry surface prism in patients with stable and progressive primary open-angle glaucoma. The modified prism incorporates a concave convex surface design to significantly decrease the Goldmann tonometer's sensitivity to all corneal biomechanics without overall population bias. The paper is a retrospective cross-sectional study over a 4-month period at a multi-special, multi-site outpatient eye institute. We include 323 eyes of 162 patients diagnosed with primary open-angle glaucoma, which was defined as progressive optic nerve fiber layer loss demonstrated by automated perimetry and/or OCT attributable to elevated intraocular pressure and no secondary etiologies. All patients had paired sequential IOP measurements by a standard GAT prism and a modified GAT prism. The cohorts were divided into 31 eyes with progressive glaucoma defined as a significant change in Humphrey Visual Field or OCT, prompting a more aggressive modification in medical and/or surgical treatment during the 4-month analysis period. The remaining 292 eyes demonstrated no progression. Corneal hysteresis and CCT data was also collected in both of the cohorts, as well as their age, gender, and racial distribution, which were all evenly matched. Corrected prism IOP measurements were significantly greater than their paired Goldmann measurements in progressive primary open-angle glaucoma compared to the stable primary open-angle glaucoma. The means for these two cohorts were 2.44 millimeters of mercury greater with the modified prism compared to the standard Goldmann prism in the progression cohort compared to 1.37 millimeters of mercury greater with the modified prism compared to the Goldmann prism. As expected, both corneal hysteresis and central cornea thickness demonstrated a significant and almost significant decrease in measurement from stable to progressive primary open-angle glaucoma. About 32% of the progressive primary open-angle glaucoma cohort and a much reduced 10% of the stable primary open-angle glaucoma cohort had an IOP greater than 21 as measured by the correcting surface prism, while at the same time the standard paired Goldmann prism measured below 21 millimeters of mercury. A modified Goldmann biomechanical correcting prism measured a significantly greater IOP than the standard Goldmann prism among progressive glaucoma patients. Corneal hysteresis and central corneal thickness decreased from stable to progressive primary open-angle glaucoma. An IOP greater than 21 millimeters of mercury measured by a modified prism and not by the standard Goldmann prism may indicate glaucomatous progression.